Let's look at this particular patient with non-Hodgkin's lymphoma. Here we have the normal parotid gland, and within the parotid gland you get lymphoid tissues, and you do have small lymph nodes in the parotid gland. When disease affects these lymph nodes, they enlarge. So in this particular patient, we have a primary malignancy. Non-Hodgkin lymphoma typically affects both lymph nodes and non-lymph nodes. In other words, you can have a tumor outside lymph nodes, just as you have a lymphoma in the brain, and you know brain has no lymphatics, has no lymph nodes, but you still have lymphomas. So non-Hodgkin's disease or non-Hodgkin's lymphoma affects both lymph nodes and extra lymph nodes, means outside lymph nodes, whereas Hodgkin's lymphoma typically affects only the lymph nodes. So in other words, if you see a lymphoma outside lymph nodes, this disease should be called non-Hodgkin's lymphoma. This is non-Hodgkin's lymphoma simply because you find that the pharyngeal lymph tissues are in there. If you remember your anatomy, there are lymphoid tissues related to the back of the tongue, as well as lymphoid tissues in the tonsils. So patients with lymphomas affecting these structures are usually non-Hodgkin lymphoma. And of course, in non-Hodgkin lymphoma, you can also have enlarged lymph nodes as well.